Assalamualaikum, Namaste, Yali Madad. Let's talk about breast cancer screening. There has been recent change by the American Cancer Society in their recommendations about when to start the mammogram screening. It used to be that screening should be started at the age of 40. For every 2 years, a mammogram should be taken, etc. But recently, well, a little while ago, American government changed that recommendation to starting the mammogram at 50, and American Cancer Society has recently, about 2 weeks ago, has changed it to 45. So basically, it's not changed; it's more or less the same as it was, but the age at which you start the mammogram has changed because they find that the information that they get between the age of 40 and 49 is not all that beneficial. Hence, government says it should be started at 50. Now, cancer breast is an emotive issue because this is the second most cancer after the cancer of skin and second most cause of death due to cancer. All these recommendations started in about 2003 when there was about 124 patients of cancer in a population of 100,000. United States Preventive Service Task Force, or USPTF, has been recommending about this. The screening is done by several different things. A, film mammography. B, digital mammography, which is a little better. MRI, breast self-examination, and clinical breast examination. Generally, film mammography and digital mammography is mostly used, and digital mammography is a little better. Generally, breast self-examination and clinical breast examination is not generally encouraged because it does not give much information. Concerns of or harm from the screening are also talked about, and that is why the change in the recommendations. There is a lot of psychological harm after having a little bit questionable the lesions that are found. There is unnecessary exposures to radiation by digital and the film mammography. There is unnecessary biopsies for lesions that are found which are false positives, and there is overdiagnosis. For example, in early stages, invasive breast cancer or ductal carcinoma in situ, as they call it, which never become clinically apparent, are found, and then if it is found, well, it is treated, and it may not be really necessary. It may not have been necessary if it was not found at all. So USPTF recommendations now is mammogram screening every 2 years after the age of 50 up to the age of 75, because they don't consider it beneficial after the age of 75, and self-examination and clinical examination is not considered to be all that beneficial. Net benefit of screening is kind of moderate. Small benefit, very small benefit between the age of 40 and 49, and best benefit is between 60 and 69. However, I will say yet our usual advice still remains the same, that is, keep healthy and stay disease proof, I would say, by keeping an ideal weight as per BMI table. Watch what you eat. Prefer whole food plant-based diet, which is WFPB, which you will keep seeing a little more in everywhere. That is whole food plant-based diet, and stay active and exercise regularly. Good luck, stay healthy.